We are so excited to be with you today. We are introducing our Wellness Wednesdays, where we are talking all things health. And today I have with me my sister, my friend, the expert, Dr. LaDena Bolton. I'm really excited to have her. It's been really difficult getting her on, but we have her on today, and she's going to be talking to us about some really essential issues surrounding health. So we want you to do us a favor and share this message out. Go ahead and press the share button if you're watching us on Facebook Live, or if you're watching us on LinkedIn, repost it, share it to a group or to a network that you're a part of. We want to amplify these positive messages so that we can get the word out to as many people as possible. We are all in the business of empowering and lifting up messages that inspire you and your families to succeed. So, Dr. LaDena is in the house. So good
Hey,
to have
hello,
you.
hello.
Hey, I am so happy to have her. She's amazing and she'll speak for herself. You'll see. But I'm going to formally introduce Dr. LaDena, and then we'll jump into some really great questions. So, Dr. LaDena Bolton is an award winning chemist and lifetime public servant. She is the youngest of three siblings raised in DeKalb County among her family of military veterans. She graduated from Savannah State University and Clark Atlanta University, where she was the first in her family to earn a PhD. That is incredible. Dr. Bolton has traveled to Africa, Asia, and Europe as an analytical forensic chemist to support national security, energy sustainability, and health disparities research. She believes that we are responsible for the health of our communities and are empowered to protect them. Dr. LaDena, she has served as the vice president of the DCAB Young Democrats Benefits Corporation, and more recently as the chair of House District 85 and the DeKalb County Democratic Committee. She and her husband, DeKalb educator Dr. Clement J. Bolton II, are the co-founders of Bolton Legacy, which is a scholarship and community advocacy program that supports college or technical school bound students interested in restoring and sustaining underserved communities. In our fair elections, LaDena served as a DeKalb County poll manager and recruited, this is amazing, over 50 fair election champions as poll workers. So she is well versed, y'all. She's doing so much political advocacy, health, community advocacy, and organizing. And she says, I work to strengthen our community foundation so we can build our own legacies outward and upward. The sky is the limit, and there is plenty of room at the top for all of us. Welcome, Dr.
Absolutely. Yes, absolutely.
Yes. Is there anything that I left out that you want to share with us?
No, actually, I was wondering who you were talking about because I do not think of myself like that by any means. But I must give the caveat because you guys did share on the flyer that I work for the Coca Cola Company. I do, but in no way am I representing the Coca Cola Company. None of my statements are reflective of that institution. I'm here as an individual who just happens to work for that institution.
Thank you so much for that. We appreciate that. So let's jump right into it. So, our first question for today is, how can people improve the collective health of their communities? We know that health is a very interesting topic when it comes to minorities and communities of color, namely because we tend to be the ones that deal with a lot of disparities with our health. And so, in your work and your research, what are ways you believe we can improve the collective health of our communities?
Well, one thing we have to consider is that there are different contributors, whether it's genetic, psychological, environmental, and we would approach these different contributors in different ways. But even beyond that, I think we have to get to the point where we can define for our communities what health or healthy looks like. Because in urban communities, health may not look like a rural community's health,
Right.
or even if we get into the demographic or population, a more populated community their health or definition of health, it wouldn't and shouldn't look like a community with fewer people, because there are fewer touch points, fewer opportunities to be exposed if we're talking about exposure. Um, and distribution of resources may be different if you have fewer people versus more, or like you were just referring to, when we have maybe an abundance of minorities or folks who their first language is not English.
Right.
So we have to redefine, or define rather, what healthy is for our specific community, and then realize it's a collective effort. You have government who usually funds it, then you have your healthcare officials or health institutions that usually does the implementation, and then
Right.
community leaders who are usually the liaison between the government, the healthcare institutions, and then the people that are seeking the help in order to become
Wow.
more healthy. So, and the people, of course, in the community should be willing. Of course, if we present health and healthiness to them in a way that they can understand and that's reasonable to them, more than likely they will be willing. So all of that codified together helps us put together the a tailor-made plan for each individual community as they define healthy. But once we develop that plan and work toward achieving it, it's usually, I'll say, like a seamless transition. And I'll give you some
Wow.
examples. In DeKalb County, for example, National Council of Negro Women, an organization that I'm a part of, we realized that based on DeKalb County Board of Health, they stated that 70% of folks in DeKalb, only
Mhm.
70% actually visit a dentist in a year
Wow.
or get cleanings in a year,
Wow.
which, if we were getting graded at school, I mean, that's barely
That's
passing,
really
right?
passing.
It's barely passing. And so, because we realized that number is so low,
Right.
we worked with county government who helped fund an initiative through Colgate Palmolive. And so
Wow.
now we have a program that we're working to make sure that we have a mobile dentistry,
Wow.
um, going through to each school and offering basically mobile visits to the students to help
That's
increase the number, at least among students, if not
yeah,
among all of the population. So, again, you have
incredible.
your government involved, you have your community leaders involved, healthcare officials. We come together, identify what the problem is, determine what healthy should look like for this community based on the numbers that we have, and
Right.
then we work toward a solution to that problem. But we do that in many different ways. I mean, 100 Black Men of DeKalb County does the same thing. Realize our graduation rate is 77%.
Right.
Again, barely passing. And this, impacts our entire lives, like
Yes.
where we work, how we operate in the world, how we see ourselves in the world. Our mental health is influenced by our education.
Right.
So one thing that they decided to do is to take a group of students across the world to
Wow.
London for the summer.
Wonderful.
Exposure opens your mind, opens your opportunities, gets you more engaged, and those students in particular have better outcomes when it comes to their education. So we have to get everybody involved. And
Yes.
it's a community effort, and it's defined by the community who's impacted by health or healthiness in that area.
Wow. I love how you broke it down in layers, but you also talked about how we're supposed to be working in concert together. So the government level, the leaders and their role, and how we work in tandem and in partnership with communities, whether it be community organizations like NCNW, which I was part of for about 5 years as a youth vice president in New York, or whether it be 100 Black Men. Um, and what I love about it is these are agencies or organizations that are within the community, and they're the ones that are defining it, but they're also the ones implementing the solutions.
Absolutely.
Um, the other thing I like that you did, Dr. B, is that you also talked about health in a comprehensive way. So not just medical, dentistry, like making sure you're going to the dentist, not having access. And I know health insurance, right? Talking about health insurance is in the accessibility of it or the affordability of it is also another issue that affects people's outcomes, health outcomes. So I guess we can go into that if you wanted to respond, but I know that to be a huge issue nationwide. So I know New York and the state of Georgia, accessibility to health care is an issue. And then the scarcity of clinics is also another issue.
Oh, and you know that's definitely an issue here, especially with the hospitals we've had closing. Atlanta Medical
Yes.
was a big deal. We recently had
Mm.
that one close. In the spring, I believe it was. And that's especially close to my heart because both of my youngest children were born there.
Oh my
My
goodness.
4-year-old and my 8-year-old were both
Wow.
born at Atlanta Medical. So to see that institution closing and yeah,
Mm.
my babies were birthed out of there was
Mm.
very heartbreaking. But yeah,
Yeah.
that, like you said, it reduces accessibility. So,
Right.
you know, if I were to have another kid, which I'm not in the market right now, um, but that completely changes my juxtaposition to health because now I
Yeah.
have to find healthcare professionals in a different area, which may
Wow.
not be in the vicinity of where I live. You know, that's one of the reasons I chose that space, but also the options that they had available. I chose
Yeah.
a midwife. My midwifery used Atlanta Medical in order to help women birth the children in the event that,
Wow.
you know, there were any issues that may have occurred. So
Yeah.
just having that option, not every hospital has that option. And I felt safer. I felt more in control.
Yeah.
And sometimes when it comes to healthcare, we kind of do what we're told to do, and we have to
Good.
remember, and I don't want anybody to misinterpret this, but we have to remember that the information we receive from our healthcare professionals,
Right.
they they're not always set in stone. You can always get a second or third opinion, but they're
Excellent.
recommendations.
Excellent.
And we do have to consider um, the communities we live in, our
Yeah.
household, how we live, our expectations and wants, our beliefs, and that's something that your physician may not be privy to.
Yeah.
So you take into account what they share with you and what you know to be true,
Yeah.
which is a part of that accessibility and being educated, being able to trust the profession or your provider, and then distribution of resources. One example that
Wow.
I usually talk about is COVID. You
Yeah.
remember in COVID, there was so much education out there. There was
Right.
miseducation, real
Oh my
education.
goodness.
There was a
Yeah.
little bit of everything.
Right.
And some education that was relevant to urban communities was irrelevant to rural communities.
Right.
So,
Right.
but and it seemed like there was an attempt for a one size fits all
Hmm.
sort of mechanism when it
Yeah.
came to taking becoming a COVID safe environment. So I would describe health servicing or health care as being local. Now, we get our funding from federal, we
Right.
get our funding from state, but the
Mhm.
actual service of healthcare should be
Yes.
local and tailor made to those communities.
Wow.
And I think that would assist in the equitability and the accessibility. When we
Yeah.
try to do too much on a broader scale, then we
Yeah.
miss the mark with some of the folks in the community because it's not relevant or relatable to their needs.
Right.
Actually, to be honest, one thing that I think we should start doing, and I'm not going to get too much into the politics of things, but um, at the very least, I think preventive care should be free for everybody.
Absolutely.
Preventive care, and that
Absolutely.
essentially will put less strain on our personal finances and resources, less
Yeah.
strain on the system's
Yeah.
finances and resources.
And
Because
save
if we're
lives.
yeah, save lives. And if
Yeah.
we're encouraging people to be more healthy, then essentially
Mhm.
we have more contributing bodies to the community. You're healthy enough to
Yes.
work, you're healthy enough to contribute. Uh,
Mm.
but we approach it from a different position
Mm.
where, and when it comes to going to the doctor annually, yeah, we really push preventive care, but you have to afford it first.
That's right.
And in order to
That's
afford
right.
it, of course, all these other wraparound services come into play unnecessarily. So, but I did want to shout out the DeKalb County Board of Health, because in 2018,
Shout out.
we initiate. I say we. I'm not a part of the Board of Health, but I'm all things DeKalb.
Well,
I
you're
was
a part.
raised in
So.
DeKalb. That's my heart. Um, but in 2018, DeKalb County initiated a preventive care program for men that was free. There was a decline in men
Wow.
receiving those services. So, of course, you would have to make an appointment. And I think it was only like 2 or 3 days a week that it was available. But in an attempt, and this is tailor made, this is local, what I was talking about, in an attempt to increase the numbers of men getting preventive care, it was free. All you had to do was make an appointment, it was free. And that helped with reducing the number of men who would come after the fact because there's a problem. They identify any issues early on or prevented issues because they were going for preventive care. But we,
Good.
the cab, and I know I probably should branch out a little more when talking about communities, but in DeKalb, like our population is so diverse. We have a huge immigrant community, huge refugee population. So language barriers um,
Yes.
reduce accessibility, right?
Yeah.
Um, and even if they could speak English or read English well, another issue is comprehension. Even for
Mhm.
someone who English is their first language,
Right.
sometimes the information that's shared is just it's not comprehensible. You
Yeah.
have to have assistance or help in order to use
Okay.
the resources that are available to you.
Yeah.
So accessibility
Mhm.
comes through making healthcare local and
Yeah.
also making sure there you reduce the language and comprehension barriers when you're sharing information for folks to access and actually use in order to help make their communities more healthy.
That's really rich information, Dr. B. You hit on so many important areas, especially within healthcare. And that's another, I feel like we're going into a whole nother avenue. It's another passion of mine is uh, Black and Brown communities understanding that you deserve quality health care. You deserve access. So I agree that we need free preventive services, healthcare services, because it eliminates all of these health barriers and outcomes, underlying conditions that we've seen in Black and Brown communities, especially during COVID, where so many Black and Brown people were dying from COVID, and could have been saved if they had a primary care doctor, if they had access, if they, which tends to be again the issues that Black and Brown communities deal with in every system in every industry, especially in our healthcare system. So I love that you touched on that. I also love that you touched on the 2 3 days of free service, free healthcare services that was provided. I would love to see that all year round, and I would love to see what the numbers would look like and how the community's health would even shift based on providing that. If there was some type of tracking of how health outcomes have improved or changed based on that care, I'd love to see those reports, especially in concentrated communities where the health outcomes are so poor.
Oh, yeah, absolutely. Now I do know that the outcomes, I don't have the specific statistic for it, but the outcomes have become better. They've increased for men.
Awesome.
Now the target was minority men in particular because
Okay.
their numbers are much lower,
Mhm.
but in general, relative to women, men overall, their numbers for being seen and their health outcomes aren't as good as women. We
Right.
tend to take a bit more care of ourselves, and if we
Yeah.
have families, we make sure the children are well. But the
Right.
men, so every now and again, they need a bit of an extra push.
Yeah. Yeah. I tend to find that in working with families, that the fathers are the ones that tend to wait until the last minute And I've heard I don't remember what doctor said this, but they said don't come to the ER when when there's nothing left, when there's no way to help you. Come when you're
Right,
feeling, before. Don't come when it's too late, because some people wait until the last minute when they get that really bad report that there's nothing that could be done, or they
right.
could have saved. I've seen, oh my goodness, someone very close to me who had fibroids and did
Mm,
not get them checked out, was getting all the health signs, but did not get herself checked out, and waited until years later and had to get everything removed, and now cannot have children. And
mm,
that's so disheartening. And so, and what we see this happening right in our communities, that's with our women, especially Black women, that fibroids being very prevalent in communities of color. And so I think this issue is it's so vast. But I do want to also mention that there is a serious mistrust that we haven't really dealt with. You touched on it a little bit, when it comes to Black and Brown communities and the healthcare system historically, right? And I think that
right.
fear is still, or that mistrust is still there, and there needs to be a lot of uh, more co-creating and collaborating with healthcare systems and doctors and communities to redefine what health looks like.
Absolutely. And I think too, that's why community organizations are important
Yeah,
because we'll trust the community organizations and community
yeah.
leaders before we trust some of our healthcare professionals or
Oh,
institutions.
yeah.
And that's because of relationships, the
Right.
relationships that were built, cultivated, sustained,
Yeah.
and the folks who we see boots on the ground that are doing the work on a regular basis, they
Mhm.
might not have the expertise, but if they share health information with us, we'll gravitate to that sometimes
Yeah.
before one of those institutions. And that's why I mentioned early on, of course, it takes government because a lot of the
Yeah.
funding comes from there. We
Right.
do need the healthcare professionals because they know how to implement whatever services that we need.
Mhm.
But we absolutely have to have those community leaders and organizations to be the liaison between the individuals seeking the services and those who are providing the resources for those services. And we have, quite a few organizations that do that. One thing I'm proud about as far as being a graduate of Clark Atlanta University,
Yeah. Yeah, that's a Clark.
um, so I did, actually, my PhD was in prostate cancer research.
Wow.
And Clark Atlanta has the largest prostate cancer center of
Wow.
all of the institutions that do that type of work. And
Mm.
so, and we refer to it as CCRTDs, the cancer center.
Mhm.
But every year we participate in health screenings, a health fair,
Mhm.
where we help with getting men screened for, of course, all of the normal health issues, the blood pressure, diabetes, but especially having them seek out getting tests for prostate cancer.
Right.
And men, they kind of stray away from it because
Mhm.
of the ideal of what it used to be to get tested. It was
Right.
invasive, it was
Yeah.
uncomfortable. Some
Right.
men felt like it was demeaning to do so.
Mhm.
But technology has changed significantly, even in the last 3 or 4 years.
Mm.
So, again, you have to educate them on those changes and let them know it's not what it used to be, it's more comfortable
Yeah.
and it's necessary.
Right.
Build that trust through the organizations that constantly do these health fairs and then distribute the resources and the accessibility for them to follow through because we don't want them to wait until they're in stage
Sure.
almost stage 7 or
Right.
and we want to catch everything early. But
No.
absolutely, all of that comes right back around
Yeah.
over and over, the education, the trust, but government, community leaders, and healthcare professionals.
Yeah. If you can talk a little bit about your research on prostate cancer, and maybe give some advice to some men that may not be aware of. One of them was technology has changed, it's not as invasive. What's some other things that you can share about that?
Yeah, absolutely. Actually, the as a chemist, the work I did was work toward developing drug delivery vehicles, which
Mm,
could be used for any cancer. But working in the center, we did target prostate cancer, and a drug delivery vehicle is basically you can think of it as a very small, a micro-sized capsule that you would put a drug in,
right.
and the drug would be delivered to the site that's infected. And
Mm,
once it gets to the site, then the medicine would be released from that vehicle. So
right,
it's exactly what it sounds like. It's a vehicle that delivers drugs to the infected site.
right.
Um, and so in that work, I collaborated a lot with the biologists and other
Mm,
students
yeah,
that did work on the other side that was more, some of them did tests on animals, others did a lot of the cell work. And
yeah.
so what we found is now you can get blood tested for it. I
Wow.
know previously
Hmm.
you would basically have to go through the rectum, right? Go
Right,
through the rectum, do some fondling around to kind of
right.
feel the abnormality, but you don't have to do that anymore.
Hmm.
Yeah, you can get blood tested, which a lot of men prefer, and within a couple days, you know your status. So, and of course, like many other things, minorities are most impacted by it. When
Yeah,
you look at the statistic, Black men are more likely to be diagnosed with prostate cancer, be diagnosed at a later stage, and have more casualties when it comes to it. And a part of it is that trust, that education, and that not wanting to be invaded when it comes to our sexual organs. But men, you can get blood tested these
can
days, just
tested.
like we test for everything else.
Yes. That's good news, and I think, uh, a sigh for many men that, have that fear of, what the invasive test has been. That technology, medicine, all of it has evolved, and it's better to know and to be safe and to get tested than to wait until, God forbid, you're on your last breath. So I'm happy that you shared that information to our men that are watching us right now. Um, I know we only have a few more moments, but I do want to hear a little more information about uh, some common misconceptions that people have about, I want to say, health and mental health. Uh,
Mm-hmm.
you mentioned some of them a little earlier when you were talking about COVID, and some of the myths that were going on, and some of them were not necessarily myths based on the community.
Right.
You can talk about some of those common misconceptions that you've seen in your lived experiences or in your work.
So, especially when it comes to mental health, many of us shy away from it. Um, and the biggest thing I want to point out is mental health is health, but there's a negative connotation associated with it. Isn't that crazy?
That
Health
is.
is a good thing,
Yes.
but for whatever reason, when you put mental in front of it, we automatically go negative. We think about
Mhm.
people that we colloquially would call crazy,
Right.
or they have these issues where they have to be medicated, or
Right.
there's something wrong with them.
Yeah.
And when in all actuality, 1 in 5 Americans experience some mental health condition. Like my husband and I, we talk about all the time how our children makes us crazy, and we joke about it, but that's a serious thing. When
Oh,
we
yeah.
were affected by COVID and families had to actually spend time together like 24 hours a day, that was hard on a lot of families. We learned a
Absolutely.
lot of things about each other, and we learned that mental health was necessary for everybody,
That's
no
right.
matter what your economic status was.
Absolutely.
And unfortunately, it took a pandemic for us to realize that, but it was necessary.
Yeah.
So, when it comes to mental health, we need to all think healthy. Health is a good thing. We
Mm.
should preserve our mental health. There
Yeah.
are all these diets and fads when it comes to our bodies and being healthy and looking healthy and strong, and we should associate that with our mental health as well. So
Yes.
we should do preventive maintenance on our, I said
Yes.
preventive maintenance, but preventive care
Yes.
on our
Both.
mental health. Yeah,
Absolutely.
absolutely. Preventive care. So, and what's funny, I was talking to my son, my seven girl, I have a 17-year-old. I was talking to my 17-year-old about it yesterday, and he kind of made a joke about how it's a thing now for adults to take mental health days. And I was
That's
like,
right.
yes,
It is a
yes.
thing. Yeah.
Just like you go to the doctor for your preventive care, I take
Yeah.
you every year. In fact, it's required for you to
Mhm.
go to school.
Yep.
Why not take care of your mental health? We use so much
Yes.
brain power in a day, especially when it comes
Right.
now. We have all this technology and
Yes.
advertising, marketing, all this
Mhm.
misinformation. Some of the information we receive is good,
Yep.
but we're constantly being bombarded. So our
Information.
minds are moving at 100 miles a minute on a
Yeah.
constant basis, to the point where sometimes we're not even resting well. We'll
Yeah.
wake up and realize our minds were going all night, and we can even
Mhm.
recall what we've been thinking about the entire night when we should have been resting. So I
Mhm.
encourage everybody to consider mental health to be as valuable and significant as our physical health.
Yes.
And the simplest things that we can do that doesn't cost any money is just reaching out to people. Every now and again I have a girlfriend that and I don't even know if I should say this, but I joke with my husband and I say, "Oh, I need some time away. I have to call my girlfriend so I can cuss, lie, and drink." Can I say that? Oh,
Yes.
okay. I do. I mean, I don't cuss or lie, but I convince myself that I will.
Yeah.
So, but you know what? It relaxes me. It get me to
Right.
a point where I can
Mhm.
just release all of the stress of my
Yes.
everyday and just let my mind recover.
Yeah.
Because when we work out, your trainer will tell you, if you work out so many days, then you need to have a rest day. It's not good
Yeah.
to work out 7 days a week. Even 5 days can be overwhelming, and they
Oh, yeah.
usually
I
prefer
know.
that you do an off day on day, or
Yep.
alternate what muscles you work. You
Yep.
can't alternate the side of brain that you use, so it's
Ooh, that's so
always
good.
working, always
Always.
working. So you have to plan mental health days,
Yes.
and if you have to do multiple in a short period of time, it's your prerogative. But
Yeah.
associate mental health with something positive. Have, friends, and take time out, reach out to people.
Yeah.
We talk about self care, and self
Mhm.
care to me is mental health. And just being respectful when somebody is having an issue,
Yeah.
because mental health issues sometimes take a little bit more energy to control
Mhm.
with respect to some of our other health concerns that we may have, that we may even hide. They're a little bit easier to hide, but when mentally, when your health is not where it should be, then it affects every other part of your life. So think
Yeah.
of mental health as a positive, a great thing. I
Yeah.
encourage it and work on it on a regular basis. Preventive care for your mental health.
Excellent. We need to do like a run an initiative, preventive care for mental health, uh,
Yes.
because we talk about it so much for physical health, and it's common. We know we have to go to the doctor. You're almost shamed if you don't. As a matter of fact, it's medical neglect if you don't take your kids to the doctor
Yes.
to keep up with their immunizations and their
Absolutely.
health.
Can't even get in school
No,
without
you
it.
can't. I just
Can't
finished
get in
with my
school
daughter. I had
without
to
it.
go to Kroger's because I couldn't get an
Right.
appointment on time to get her clearance for school. And
Mm-hmm.
yeah, we are consistently prioritizing our medical health, our physical health as we should, but there is such an integration. I have seen the correlation between health outcome and mental health. And there's so many sicknesses that sometimes are exasperated by mental health issues.
Mm-hmm.
Trauma being one. There's research going on now that shows how chronic trauma or chronic stress can really affect your medical health, your physical health. So it's important that we're taking care of both. So thank you for that. Preventive mental health care. We need to have that as an initiative.
Absolutely.
I endorse it.
Look, we coined the phrase right here on I Raise. I'm a poet.
Yes, you are. All things. I love it. What's in your closing, Dr. LaDena? What advice can you give to our parents in keeping our kids safe? We're going back to school. We've been seeing already. I'm seeing, oh my goodness, people sick with fever. And a kid that I know was hospitalized for pneumonia, and
Mm.
going back to school. My bonus child, his first day back to school, he had a fever. I'm like, you just left here. So, kids are going back to school. It's the season. What advice can you give to parents on keeping their kids safe in this season?
Wow. Always we go to the easiest and simplest thing. We don't want to make anybody's life more difficult because we're already bombarding you with things that you should be doing to stay healthy. But at the very least, make sure we're teaching our kids just to wash their hands regularly, be clean. One thing that I started doing this year that I didn't do before COVID, I actually pack hand sanitizer in my boys' pencil
Excellent.
pouches.
Very good.
So yeah, I put the hand sanitizer in there,
Mhm.
and wipes. I'm seeing now that a lot of teachers are asking for the Clorox wipes, and they're
Yeah.
making it a regular part of the
Yep.
classroom for the kids to wipe down between classes or lessons or
Mhm.
sessions. So being more engaged with your students, teachers, so that we can equip them to use those resources,
Yeah.
whether you get a bottle of sanitizer for the class. I just chose to do it for my students, but a bottle of sanitizer for the class,
Mhm.
Clorox wipes for the class.
Yes.
And But for the most part, they've been doing a lot better. At least I've seen with some of the schools in DeKalb County, they're cognizant of that. One thing that DeKalb, I think, did a great job when it comes to DeKalb County school system, and we're a great example, is that when all of these different institutions received the AARP money or the COVID money, a
Mhm.
lot of institutions were receiving the federal COVID money,
Right.
and it was, most places used it for supplies or PPE, different stuff like that.
Right.
DeKalb County actually used the money for to improve their ventilation system. And
Wow.
ventilation, of course, that's how we get COVID. We're breathing in and out the same air
Mhm.
all day long. And
Yeah.
so making sure that the air is cleaned before it's cycled through,
That's right.
make sure we give the kids um, a step above to be healthier. And that's something, parents aren't able to do. But I did want to bring that to light for
Yeah.
anyone that might be watching in another area that may have the resource to do that at their school if they have the
Yeah.
funds available. But at the very least, yeah, you talk to your kids about it. Actually, I ordered some books. So with my husband and I, we have a nonprofit organization, Bolton Legacy, which you did describe as a scholarship program. But in addition to that, we do a lot of distributions, and we partner with institutions across the cab. So for back to school, we did a lot of back to school events, and the coloring books were for elementary school students, but it
Nice.
was about how to be healthy and stay healthy and clean, not just for COVID, but in all areas,
Nice.
whether they're bathing or washing your
Yeah.
hands before you eat, making that a habit, washing your hands after you eat. So
Mhm.
making being healthy fun, something that
Yeah.
younger students can understand and relate to through coloring books and stuff like that. We just have to get creative with the kids. And,
Yeah.
it used to be a time where this was information that was meant for adults. Adults talked about it, adults planned it, adults implemented it, but we have
Mhm.
to include the children because they're affected just as much as we are. They're part of the community just like we are, and
They
they will
are.
be leading the community when
Yeah.
we're too old to do it. So just make sure we're engaging the kids when it comes to these sorts of things.
Excellent, excellent. Thank you so much. You gave me some advice as a mother too. So I was taking some pointers in my head, but just reminding my daughter. It sounds so simple, but do you wash your hands? Did you wash your hands? Because they're always, oh, get your hands out your mouth. Or your hands are in your,
Mhm.
go wash them. Because that could literally be, um, that is a preventive way from your kids getting sick this season. So, echoing your sentiments, we want your kids to be safe. We want you to be safe. We want you to be healthy. And that's why we're having these Wednesday wellness Wednesdays. So, Dr. B, thank you so much for your wealth of information, for your service to the community, to DCAP, and tell us how could people follow you, reach out to you if they are interested, and just talking to you more, or connecting with you.
Absolutely. So I love connecting, obviously, especially in DeKalb. I've said so much about it already. And actually, my website is boltonfordecab.com. My Instagram is boltonfordecab, but you can email me at joinus@boltonfordecab.
Thank you.
I'm here for it.
Yes. So if you're interested in connecting with Dr. B, as she said, she loves decaf. She's doing great work out there, working with the communities and through Drive. She has a foundation. So if you're interested in partnering or learning more about her foundation, you can go to either reach out to her through her email, join us at boltonfordecab.com, or to her website, boltonfordecab.com. Thank you so much, Dr. B. We appreciate your time here with us. And we thank you all so much for watching and for tuning in. Remember to stay safe this season, especially to our families, our kids that are going back to school. We want to make sure we keep the flu and the COVID numbers down this year. So please do everything you can, parents. Get healthcare insurance. If you don't know where to go, please, you can reach out to iRaise. Follow us as well at iRaise Inc. You can visit our website at www.iraiseinc.org. We're happy to support in any way that we can and connecting you to the right resources. But this is all about your health. We want you to be well. We want you to be well in your body, in your mind, and your heart and your soul. So we appreciate you all. We love you. We'll be back tomorrow for a fireside chat on Thursday. And then don't forget to check out our ATL Rice podcast. New episode will be released this Friday. So we're excited and we appreciate you all. We will see you soon. Stay tuned.